AM 1260 KLYC, and we are here at Bi-Mart in McMinnville, and we have the pleasure to talk to Rosemary Davis, who is the CEO at Willamette Valley Medical Center, and we are here helping to stuff the bus. There's a big yellow school bus out in the parking lot, and thanks to your help, we're stuffing it with food and toys for needy families and kids. Isn't it fun?
It is fun. It's all for YCAP, and we can't thank Grocery Outlet and Bi-Mart and our friends and neighbors throughout the community who over the last 2 days and really days beyond and before this for supporting the needs of those that could use a little assistance this Christmas.
And we'll be here at 3 o'clock this afternoon here at Bi-Mart, so you can help us stuff the bus. The goal is to fill the bus.
Right. So we've got cars that have been pulling up all day and dropping off sacks of groceries. We've also had people coming through the line here at Bi-Mart, and they'll just buy 1 or 2 extra items, maybe some popcorn or canned goods or a Barbie doll, and they leave it at the box at the end of the checkout, and those all go into the bus. The bus is now I think it's about 3/4 full from the floor to the ceiling. So it's been a very good year in terms of collections.
That's exciting. Let's talk about some exciting things happening at Willamette Valley Medical Center. We've heard about the shortage of physicians in our community. What's happening at the hospital to bring more doctors in?
Well, you're right about the shortage, both for primary care and for specialists. We've seen over the last 18 months about 6 physicians who have left for one reason or the other. Most of it has been to retirement. So we're in the process now of replacing those folks. We have a Dr. Andrea Galang who is joining us. She's an internist, and she is also specialized in geriatric medicine. So she will join us in July. We have PMC recruiting a pediatrician, Virginia Garcia. We've helped recruit a pediatrician as well as a nurse practitioner. There are several specialists, including a urologist that will be joining us. Actually, 10 doctors in all will join us in 2014. So by the end of the year, my true hope is that any and everyone seeking a physician will be able to easily find one and not have to worry about that.
That's great news. So are you looking at bringing new services or new specialists to McMinnville?
We are. So the Dr. Abid is a pain specialist. He had previously worked in Salem and prior to that to Boston. He is currently seeing patients, so that's a new specialty for us. Also, Dr. Higa is now doing bariatric surgeries. And for those of you who are Medicare age and have been thinking about it, that is now covered by the Medicare program. So that's something you might want to think about. He's located in the complex over by Chemeketa College. And we also have a new woman, a female GYN. Some of us gals would prefer to have a woman, others not so much. It doesn't matter. But for those that it does matter, Brandy Spence is there to take on new patients.
And sometimes just certain things just need a woman's, I want to say woman's touch, but just a woman to talk to a woman about certain things. And it's nice.
Sometimes it is. You're right.
Now let's talk about a new organization called Willamette Valley Health Solutions. What is that all about?
So this is a corporation, a limited liability corporation that Regents Blue Cross, our hospital, and most of the members of our medical staff, our physicians in our community, have partnered in. Our plan is to continue to create an clinically integrated delivery system and develop an insurance product that within 3 months we should be able to present to the community for individuals, small and large businesses. The goal would be to significantly decrease the current premiums that individuals and businesses are paying and be able to do so because of a more narrow provider network, thus making it less costly and be able to drop the premium costs. So I'll come and visit with you at the station when we're closer to launching that product, but my fervent hope is that we're successful with this because it would be a great benefit for a lot of folks.
And there's a vested interest in everybody, in the healthcare providers, in the hospitals, and the consumers to see the costs come down.
You betcha. You absolutely are right. And I wanted to talk to you about folks who currently don't have insurance. Cover Oregon is struggling to get up on the internet site, but you still can sign up for Medicaid insurance, and I'll give you information to broadcast so that you can share with people where that is. But also for those folks who don't have insurance, when you come to the hospital, I want you to know that immediately your bill is discounted 60%. And if you can validate an income level at 200% of the poverty level, we will write the whole bill off. So we've had these policies in place, but I'm not sure that everyone knows about them. So if this is a tough time for you and you're needing health care, you can get health care. So don't not do that and make things perhaps worse.
So one of the challenges is we've done a lot of health stories is sometimes people aren't getting preventative or inexpensive care and they're waiting for problems thinking it'll go away or just wanting to put it off or not wanting to do it because they're afraid it's going to cost a lot of money. But if there's an issue, sometimes the saying is an ounce of prevention is worth a pound of cure.
Pound of cure.
And sometimes, we're here at BuyMart, as you can hear in the background.
Got some work going on.
Yeah, we do. But sometimes it would be a lot cheaper for you to get medical attention sooner than waiting until the problem gets a lot worse.
So really my goals for this next year is to make sure everyone has access to a physician, primary care or specialist, and then access to whatever care that physician and the individual feel that they need. Insured or not insured, we can take care of you. We have policies to help us do that. So, as you said, an ounce of prevention is many times worth much more than a pound of cure.
And sometimes it can mean your life.
Yes, it can.
And we want you around.
Yes, we do.
So we're here at BuyMart till 3 o'clock this afternoon. We're having some fun today, stuff in the bus. It's 3/4 full.
It is. You can see the packages, the food items, the toys above the windows of the bus. So that's a very good sign.
And we thank the customers here at BuyMart in McMinnville as they've been really busy today.
They have. It's been a constant stream, and they've been very, very generous.
Oh, they have. And we've seen everything. We've seen food. We've seen toys. People even gave me money to give to Whitecap. Yeah.
Well, good. All right.
That doesn't happen every day.
But it's a lovely thing when it does.
Oh, yeah. And we turned right around and gave it to Whitecap. So we'll be here until 3 o'clock this afternoon. We'd love to see you down here as well. Rosemary, it's been good talking to you, and we're talking to some good folks with Willamette Valley Medical Center about some other things. One of the things I'm interested in hearing more about is hyperbaric medicine.
Do you remember the old Sea Hunt TV series where the scuba divers went down hyperbaric medicine is a derivative of depressurizing from those dives. So right here in McMinnville, we now have a third chamber. You'll hear more about it, but that's the medicine we're talking about. And the high concentration of oxygen in those chambers has made it possible for us to have a 98% heal rate for wounds that historically have just not gotten well. But now we're able to do so.
Burn wounds or other wounds?
You know, let's talk to the folks when you have them up at the mic. I don't want to steal their thunder, but it really is a miraculous thing.
Okay, well, thank you very much. Have a good day. Merry Christmas.
Merry Christmas to you and to all of you.
AM 1260 KLYC, and we'll have more from BuyMart, so stay with us and tune to the radio AM 1260 or watch us on the website, klyc.us. Or you can also go to our website later and watch the interviews. All of the interviews that we do on KLYC, video interviews and audio interviews, you'll be able to find by clicking the YouTube link on our website, and they're right in order, the most recent on the top. And if we interviewed you, it'll be there. So looking forward to talking to you again. Looking forward to talking to you as well.
Thank you. Bye, Dave.
AM 1260 KLYC, more to come.
All right, I'll go get Connie. Is that good?